Heard It Health is sponsored video content brought to you by MedCity News.
Hello and welcome to Heard It Health. I'm Katie Adams, a reporter with MedCity News, and I'm here with Dr. Lynn Nowak, who is the Chief Data and Analytics Officer at Surescripts, which is a company that helps connect clinicians with patient intelligence. Thanks for being here, Lynn.
Thank you.
So, as Americans are increasingly struggling with chronic conditions and comorbidities, the shortage of primary care providers is also getting markedly worse. So, I know Surescripts has published a few reports about, the role that pharmacists can play in addressing the shortage, kind of taking over to fill some of those primary care provider needs. Can you go through some of your findings?
Sure, and thanks for the question, because it's a really, really important topic that, surprisingly not enough people are talking about, this sort of impending primary care shortage. I'm an internal medicine physician myself and spent many years in the trenches practicing, and provider burnout, clinician burnout is a real issue, particularly, following the last several years of the pandemic. And so we wanted to look into this and see how could our data, how can we look at the prescribing trends and patterns that we've been seeing throughout the country, inform us a little bit about what's going on, and maybe give us some insights into, how might we help support really the expanding role of the care team, not just the physician, since we just simply aren't going to have enough physicians. We're facing about 140,000 physician shortage over the next several years, so we've got to make up that gap somehow and really help providers, or really help our patients get access to the care that they need. So some of the things that we found were that, there really has been an increase of non-physician clinicians accessing the Surescripts network, both as non-physician prescribers and also just as clinicians and non-physicians who are using the Surescripts network to access clinical data. So again, as we're expanding into a care team and really help enabling that whole team to get access to clinical information, clinical pricing information on medications to help patients reduce the cost of their medications or know what kind of price they're going to get when they get to the pharmacy. The sharing of all of that clinical data is super important. And we really are seeing an increase in non-primary care, non-physicians on the prescribing network. It's still very small, but there has been an increase.
Excellent. So thank you for going through that. I wanted to pivot to a different topic that I've been hearing a lot about here at Health, which is affordability. And we all know how outrageously expensive drugs are in this country, and we know that, often those high prices lead people to ration or skip their meds. So, from what you're seeing at Surescripts, can you explain why connecting patients to more affordable options, can really improve that medication adherence?
Yeah, thank you for the question. Really, really important topic as well. That, we know adherence to medications is incredibly important for patients maintaining their health and getting healthier when they're sick. And they're not going to take their medications if they can't afford them. So helping connect patients to that real-time pricing information, helping doctors have visibility to that pricing information so they can understand what's going to be the best option for the patient to make sure they can afford it. The Surescripts real-time prescription benefit application into the real-time workflow of the physician allows us to do that. And the doctors can see exactly what that cost is going to be for the patient. They can have that conversation, make sure the patient can afford the medicine. Maybe they can discuss about different alternatives that might be available to them, and really make sure that when they get to the pharmacy, they won't have a surprise and they know that it's an affordable option for them and likely to stay on their medication since they can pay for it.
Well, before we end our conversation, I wanted to talk about how many different stakeholders Surescripts works with. I mean, you name it, PBMs, health plans, hospitals, vendors. With that in mind, can you talk about the importance of really aligning all these stakeholders under one common goal?
Absolutely, and it's one of my favorite things of being at Surescripts is really how we do work across multiple stakeholders, really all of the stakeholders across the healthcare industry. And while sometimes they compete or sometimes there may be some conflicting interests, what we found through the Surescripts Network Alliance is that there's a lot more common ground than you might think amongst all of these different stakeholders. And really when we put the patient at the center of everything we do and we really help everyone focus on what's best for the patient, you'd be surprised how well aligned the different stakeholders are, even if it's competing health plans or competing EHRs. And we can really serve as that convening group to bring all of those different stakeholders to the table and try to solve some of the big challenges like affordability and access and even a better experience, helping reduce administrative burden for both the doctors and the patients. So going across all of the industry is one of, really personally, one of my favorite things that the Surescripts Network Alliance allows us to do.
Really bringing everyone together.
Yeah,
Love it.
absolutely.
Well, thank you so much for your time, and I hope you enjoy the rest of the health.
Thank you so much.